When a healthcare professional's made a diagnosis of osteoarthritis, we know that they often use the term wear and tear, and this is an unhelpful term to use for patients. We know that patients interpret this either as being something that is normal and nothing can be done, or that using the joint is going to cause more wear and therefore more tear or damage. And this creates anxiety amongst patients, particularly when one of the main treatment strategies is exercise. So patients get pain on exercise and then they get concerned that they're wearing and tearing their joint more, and then they don't exercise and it ends up being a bit of a vicious circle. So some of the helpful things we can say is that there is something that can be done, that we know that activities such as exercise or physical activity can help to improve inflammation in the joint, strengthen the joint and stability, and this in turn can help to improve function and pain in patients. We term this repair, and this is repairing a function, but not necessarily repairing the joint right back to its natural state, but it does help the patient to understand that they're doing good for their joint by the treatments they're undertaking.
I got involved with Jigsaw UK about 2.5 years ago when Stephen telephoned me and asked me if I'd like to attend a conference at Keele. The conference involved international conference with other countries involved. Everyone showcased their particular healthcare system and PPI system, such as it was in those days. They really inspired me by the fact that everyone was exceedingly positive. They were all thought that it was going to be very difficult to align our systems together. No one said it was impossible, and everyone, I thought they were so dedicated and really wishing to move Jigsaw on that it was just inspiring, and I really wanted to be part of it. With Kathy, my Jigsaw partner, we've collaborated with Norway on the quality questionnaire things. We've searched, or we've looked at the Jigsaw website for the patient content of the Jigsaw website. There are lots of sort of little things that we've been involved in, posters and things like that are just trying to get the message out there.
So a really useful source of information for patients to support them to exercise comes from Versus Arthritis, and there's a Keep Moving leaflet that we've been handing out as part of Jigsaw in the UK, and that's got a really nice pull-out which shows patients how to do different exercises for different joints, as well as providing practical advice, and I use that very frequently in my surgeries.
We're the end user of whatever the research comes out, so we should have this fundamental role. And I think that certainly over the past 10 years, PPI has come on leaps and bounds. The Link Group was set up in 2016, about the same time as the Jigsaw conference was. It's fairly unique, I think, in the public participation, because we get the opportunity to not only to vet things that are coming through and to look at things that are coming through from the researchers. The things that we've been involved in are quite unique, I think, because they don't come from the research side of the program. They come from the patients part of the program.
Yeah, well, now the benefits is if you being physically active and doing exercise, it has also the benefits of less pain. We know from research in OA, but it's also other advantages for your whole physical health. It prevents for diabetes or for heart failure if you do that kind of thing. So exercise is very important. It's part of the healthy lifestyle, and an important part. And also food and rest and less stress, but certainly also exercise, or being physically active.
Patient voice in Jigsaw is absolutely essential. We have to have the patient, who is the end user, with a say. Years ago, when I first started at Keele, I was in a subcommittee meeting, steering committee meeting, and I asked a question. I'm not experienced in any clinical matters at all, and I asked a question, and one of the professors looked at me and I thought, oh, that's a silly question to ask. And he just looked at me and said, I never thought of that. And from that moment on, I then believe that the patient has a great role to play in research, and Keele do it best. It's great fun to be able to talk to a lot of other people. Everyone wants to talk to everybody else. You know, it really is a coming together of like minds, but slightly different systems. And we learn from them, they learn from us. There are lots of things that we could do that they do in Europe. And similarly, Europe have taken a lot from Keele. The patient does have a fundamental role in research. What is research for if it's not to advance, the care and treatment of patients? And if it's for the care and treatment of patients, then we need to be involved at all stages to make sure that we're getting what we really want. Greater and better care, better understanding, better cooperation, better collaboration with doctors.
I had to lower the time of working, part-time working. But I can hold it on till I was 65, and then again on pension. And now I know that I have to do a lot, to move on, keep being in movement to handle it.
So some of the most helpful things that healthcare professionals can say to patients with osteoarthritis is that there is something that can be done, and there's things that can be done even when the condition's quite severe. Physical activity, which is one of the core treatments, can be helpful for all patients, even if they're looking at having surgery, for example. So we do know that strengthening the joints and keeping as active as possible results in the best outcomes for people. Healthcare professionals can think about using terms such as repair, and what we mean by repair is not repairing the joint back to where it used to be, but more about repairing the functioning of the joint and reducing symptoms. So for example, thinking about exercise, helping to reduce inflammation but also improve the strength of the joint can be really helpful. And so patients can return to better functioning with less pain, and that's what we mean by repair.
I think patients are quite critical in improving healthcare. Patients can help in improving by just presenting the patient perspective. And I think that is something that is more than we want neglected. There are still a lot of shortcomings in healthcare, and people have to face problems, things that are logistically not really good organized, information is not given well. And I think one of the causes therefore is really that patients have not been involved in the development of care path or materials that should inform patients. And I think by informing and involving patients in improving healthcare, products and services will be much better tailored to the really needs that patients have. And I think it's specifically the unmet needs that patients have that they should bring up. Also to help healthcare professionals to really address these and to look into the opportunities, what should be changed and how can we do that. So it's a kind of co-production, as we call it nowadays, making things better by collaborating patients and healthcare professionals.